Do if your implants are too high after surgery. They're not sitting down in the proper position. So I don't know exactly what's going on with you. I know in your comment you say it's from swelling. The most common reason someone's implant is sitting high after surgery is because it's under the muscle and the muscle has spasmed or become really tight. Now, in the operating room, when you're relaxed and under anesthesia, it's fine, but as soon as you wake up, you're in a little bit more pain, up the implant goes. Now, just tincture of time will bring the implant back down for a majority of people. A lot of surgeons, if you have this problem, will put you in a strap. So you'll be in a tight strap that velcros across your chest and will push the implant down with time. But honestly, just tincture of time will help this problem. The other reason your implants can be sitting high at first is because you just had a breast augmentation and your tissue is tight. So that tight tissue hasn't had time to stretch and allow the implant to settle into a good position. And this can happen for both under and over the augmentations if the tissue is tight. So again, tincture of time is the right treatment. Sometimes surgeons also, I'll add, will have you massage your implants. I'm not a huge fan of this and I'm not sure it really does anything, but it probably won't hurt. So if your implants are misbehaving and your surgeon has you do some massage to try to help them on the way down, so to speak, that could be an option too. And then finally, I'll throw out there that you can develop early contractures for both a hematoma or a biofilm. So if your implant is up after surgery, especially if it continues to go up for a while and you're like 4 to 6 weeks out, you have to be concerned about a capsular contracture. And it's difficult as a patient to determine what is exactly going on because things can be really tight in that time period, but your surgeon should be able to diagnose that. So my advice is always check in with your surgeon first because you want a good diagnosis. You can't get the right treatment if you don't know exactly what's going on. And like I said, a few different things can look like this. The next thing that works with most patients is just tincture of time. So with most of these problems, allowing everything to heal and settle, the collagen and everything to mature will allow your implants to come down with no intervention. So the reason why I don't think swelling is typically an issue is because swelling is global, it's everywhere, it's not like on the bottom pushing things up. So when you're swollen, you're kind of swollen everywhere. So hopefully that helps. Let me know if you have any more questions.